So are you seeing the PowerPoint? Okay, great. Alrighty, so welcome everybody to the Central New York Cash Coalition's Financial Friday series. We are really glad to have Stephanie Pestillo here with Fidelis Care to talk to us about health insurance, the marketplace, and open enrollment. Health insurance is such an overwhelming topic. It's so critical for us to take care of ourselves and our families, and it's a little bit expensive. So we thought it was a great topic this time of year as everybody's coming up on the open enrollment season. Let me tell you a moment just about the Onondaga Cash Coalition. CASH stands for Creating Assets, Savings, and Hope. And the Cash Coalition is a coalition of local organizations dedicated to promoting financial stability and asset building opportunities for low and moderate income families here in Onondaga County. And a lot of this information is good for absolutely everybody. So it's so important for us to all take care of our financial health. We are with NEDA. I'm Andrea Wandersee. I'm the executive director of NEDA. My partner, Taisha Martin, helps coordinate this program. And we are delighted to have Stephanie with us. She handles community relations for Fidelis Care. She's been part of the Central New York healthcare community for over 2 decades, with a focus on culminating positive partnerships and relationships within the area. She's proud to be a part of the NAACP Healthcare Committee in the Syracuse region. Stephanie has affiliations with various committees and organizations in the area, including the Interfaith Work Senior Companion Committee, the Onondaga County Cash Coalition, sponsored by United Way, the Greater Syracuse Aging Services Coalition, the Oswego County Drug and Alcohol Coalition, and Caring Community Advocates of Oswego County, along with the NAACP Healthcare Committee. Her focus is on the community. Her focus in the community is to be a positive and easily accessible resource and to assist the community in the social determinants of health that face so many currently. Ms. Pestillo holds a bachelor's degree from SUNY Oswego, and along with her full-time career, she's a part-time mental health counselor here in the area. Stephanie and her husband, Nick, are lifelong residents of the Syracuse area. They enjoy travel, a great network of family and friends, and visiting, as we've all finally gotten back to at the New York State Fair. Stephanie, thanks for being here with us, and I will hand things over to you.
Great. Thank you so much for having me. I do appreciate the time and the opportunity to present on behalf of Fidelis Care and just in general on behalf of all of the insurance companies in the area to explain, simplify, and hopefully just give some specific details on the health insurance right now, specifically the open enrollment for 2021 going into 2022. What I'm going to share with you are the most recent updates as of November this month. And the reason I say that as far as the most recent is in our world right now with so many things forever changing, this could change next month. So what I tell you right now may be applicable right now, but it could have the possibility to change as we keep healthcare right now so fluid and so open with the pandemic and with COVID and with continuing changes. So with that, do note that the dates that are listed in the upcoming slides are as of right now. And literally, believe it or not, this morning, from the time that we finalized this presentation until right now, there has been an update with New York State Department of Health. So that's how quickly things can change in the healthcare field and in open enrollment and state programming. So Andrea, I'll have you go to the next slide if that's okay. And I'll just start right in on some key dates for you and some key things that the general public would want to know about some open enrollment. The first category is Medicare open enrollment. So Medicare open enrollment is already underway right now. It started October 15th and it goes through December 7th of 2021. And Medicare, remember, is the program that is focused mostly on seniors 65 years of age and above, or those that are deemed disabled or in some category that they are Medicare eligible. These individuals that are currently on Medicare during that time frame can look into other plan choices. And this is where we all health insurance companies in the area encourage individuals to look into their options. The reason that there is an annual enrollment for these particular programs is that seniors and disabled individuals' needs change. One year they could be healthy, everything could be going good. The plan that they have seems to be sufficient for their needs. And then in the course of a few months or sometimes suddenly, healthcare needs can change. They need higher levels of care, higher levels of service. Prescriptions may have become more of a common place that they need to access prescriptions more often. All these things take into play that everyone who falls into a Medicare category during open enrollment should look at all their options. So when I speak, like I said, not only on behalf of Fidelis, but in reference to all the plans. We urge you to look into all your plan choices. There are a variety of options across New York State, including Medicare Advantage and supplement programs. And what I want to do is just take a moment to explain the differences of those programs so people can understand the generalized differences. So a Medicare Advantage product, think of it more as a product for individuals that, generally speaking, are fairly healthy. They access the doctor for their regular health and wellness needs. They have generalized prescriptions, possibly a few maintenance prescriptions. They go to the doctor generally for their normal physicals, maybe one specialist, maybe two, but possibly in the category of chronic care or specialized needs, they may not fall into something very high end. The Medicare Advantage program is often a good fit for them because it's a free program to enroll into, and then there are appropriate co-pays, deductibles, et cetera, along the way. So look at the Advantage program is that the advantage of it is it's zero upfront, and then you pay along the way. The supplement program, generally speaking, is a higher level of coverage. Supplements generally start in the range of around $100 to sometimes in the hundreds of dollars for the monthly premium or fee. And then every time there is a copay, a deductible, a prescription fee, those rates can be lower on the back end. So a program like a supplement program is good for someone that utilizes doctors and providers quite often. They would pay a little bit more at the beginning of the month, and all of their services and needs that they would have through the month, they would not have excessive copays, anything unexpected out of pocket. They would know that it's a lower cost and it's more affordable in the long run for them. So I wanted to explain these differences and make sure that those that are watching, just the general consensus and understanding that there are the two different types, and you should definitely be shopping and looking for these. We at Fidelis Care have specific enrollers that all they do is handle Medicare. So that staff handles making sure people look into these programs and find the best fit for them. Some of the things that you want to look into for the best fit into a Medicare program would be prescriptions. What prescriptions are you on? The doctors that you see, the specialists that you see, the hospitals that you want to access, and then any other extra services such as gym memberships, transportation. Some programs offer different buyback programs and payback programs that they can get to help assist pay for things. So all these things they're going to want to look into. Also, not only do we have enrollers, there are brokers throughout the community that can help with a multitude of these programs. So we encourage you, now's the time. Look and find what you can find that best suits your needs. And again, the enrollment goes up until December 7th, and then the new plans would take effect for January 1, 2022. Okay.
And so Stephanie, are you saying like if somebody calls their health insurance company, there's a staff person who can maybe help them untangle some of these questions and say, oh, based on this, you should go this direction, or based on this, we would suggest you go this direction?
Absolutely. Their health insurance company, or if they do have an independent broker, they would want to take a look at this. Absolutely. Perfect. And then our next slide, we're going to touch base on what my specialty is in my area, which is the New York State of Health, or NYSOH open enrollment. This is the area more that I have more expertise and can assist a little bit more with, whereas Medicare, we leave that to our Medicare pros for that. So everyone has heard most likely of the New York State of Health, or the marketplace for enrollment. And this is the place essentially that you want to shop for health insurance if you do not have access or are not offered commercial health insurance. So I want to take a minute to explain those differences. Commercial health insurance is through your employer. If you're self-employed, you may buy into something. It would be through your spouse's employer. If you are dependent or in some capacity, that's what commercial insurance is. Public health insurance, the opposite of that, are state-run health insurance programs that are not employer-based. So I want to make sure I clearly separate those two so you know the difference. So what we're talking about today specifically is the public health insurance. So when you can enroll into these New York State of Health programs is dependent on your age, your income, and other household factors, such as the number of dependents you have in the household, how you're filing your taxes. All of these specific criteria will put you in certain categories, and then from that, we will know which program you appear to be eligible for. With that eligibility, then we can determine if you're in an open enrollment period, if you're out of an open enrollment period, or possibly if you qualify for a special enrollment period. So let me start with step one, Medicaid, Child Health Plus, and Essential Plan. If you have a family and they qualify into any one of these categories, Medicaid, Child Health Plus, Essential Plan, they can enroll into these programs year round. It doesn't matter the circumstances. It doesn't matter that they moved into the state or they've changed jobs or whatever happened and insurance was lost. There's no penalties. They can enroll into it at any point in the year. And they would then from there pick the appropriate health insurance plan, pick their providers, where they want to go to the pharmacy, dental, vision, et cetera, et cetera. So that again is year round. Where it gets confusing, and a lot of people get very gray in this area, is when you can enroll into a qualified health plan. And that's what we're in now, is that enrollment for the qualified health plans. So what the qualified health plan is for individuals or families that do not fall in the categories of being eligible for Medicaid, Child Health Plus, or the Essential Plan. So look at it from the point that if you're looking at an income base, just as a general rule of thumb, we always say Medicaid is your lower income threshold. That would be the baseline, the lower. Your Essential Plan is like a mid-range income. It's a little bit higher. You may be responsible for some premiums out of pocket and very small co-pays and very small deductibles. And then if you're in a higher income level, we're very fortunate in New York State that there are no income caps on these programs. But if you're in a higher level, that's when you would fall into a qualified health plan, which is more like your standard regular health insurance that you pay a monthly premium for. You have a certain percentage that you would be responsible for. You have your standard copays, your standard deductibles, your standard maximum out-of-pocket expenses. And then the last program, Child Health Plus, again, would be specific if it was a child 0 to 19. So we put them in a little bit of a separate category because the ones that you have to worry about essentially for an adult initially is Medicaid, then Essential Plan, and then the Qualified Health Plan, if that makes sense. Hope I'm not confusing anyone. But as stated, right now is that open enrollment for that Qualified Health Plan. The open enrollment period right now is November 16th till January 31st of 2022. And so that's coming up very soon. But this is where there's that little caveat and that little change in it, because this information is forever changing. Right now, we have been in a special enrollment period throughout most of 2020 and all of 2021 now because of the situation that we're in with COVID. So the special enrollment period started around April of 2020, and that it doesn't matter what is happening in your situation, why you lost a certain insurance. If you're in that level, you can qualify now and you get on the first of the following month after you enrolled, if your application falls within the deadline of a 15th of a month. Why this is great right now is, again, there's still so many circumstances out there with people still being laid off and their insurance is just kind of pending and it's there and possibly the employer is still paying. and then something changed and now they've lost the job completely, and then the insurance cuts off. I mean, it's so many, that's just an example of one. There's so many circumstances right now around jobs and insurance, et cetera, that we're grateful that New York State of Health has given this extension. But what they want to have individuals focus on right now, on that open enrollment period that is still going to happen from November 16th to January 31st, is that they want the individuals and families to update their information. Because it has been 18 months now, maybe the families have not updated current address, current phone number. Maybe there's a new addition to the family. Maybe there's a subtraction from the family. All of these things are pertinent to their insurance information and their application and their coverage, essentially. So we want to make sure that they take that time to truly focus on updating that information, because eventually there will be a point where they're not going to have this open enrollment period ongoing. So we are not 100% at this time, but we are guesstimating that as of January 31st, 2022, that will officially end that open enrollment period. So if someone fell into that qualified health plan category on February 15th of 2022, if they were outside of that open enrollment period and did not have a qualifying reason, they simply would not be able to get on at that time, because it's just been ongoing for so long. I told you that when we began this, that there have been changes that were made just in the past few hours. What we did receive notice of in the past few hours through New York State of Health is that anyone who is in Medicaid, Child Health Plus, or Essential Plan, annually they are expected to do a renewal or a recertification. For the past 18 months, those have been automatic, and families and individuals haven't had to do anything in reference to this because of COVID. We now receive notice that that will continue until December of 2022. So there will be no renewals that the families will have to do, again, for those three categories: Medicaid, Child Health Plus, or the Essential Plan. What this does is that it offers continuity of care. You have a family that still may be in crisis mode, that still has so many things going on. The last thing they've thought of is renewing their health insurance. This guarantees that their coverage continues, and they will not lose access to those medical appointments, those prescriptions, heaven forbid if needed, urgent and emergency care, specialty services, surgeries, et cetera, et cetera. So that was the newest. That wasn't even able to be added into these slides because it just happened. So in saying all of this, again, I want you to denote the difference. Again, like we said, the Medicaid, Child Health Plus, Essential Plan versus the Qualified Health Plan. The renewals right now for Qualified Health Plan, those individuals still have to renew. So if you see in the bottom of our slide here, the renewals for current Qualified Health Plan members must be completed between November 16th and December 15th for them to continue their coverage. So you can see it's like certain categories of people fall into having to renew, other people don't. As far as the overall open enrollment, that's been open, but that eventually will close off. So it can be very confusing, excuse me, to the average person to go, whoa, first of all, I don't even know what I qualify for. I don't even know what plan is what. And now you're telling me about all these open enrollment periods and special enrollment periods. It can be very confusing. So how we alleviate that for you is, again, just like how we talked about Medicare, is we have those specialists on hand that handle all of this for you. This is not something that you nor I, if we were not insurance pros or just the general public, we would even know how to tackle or handle. So we have staff that can help with all of that. They are available every day of the week. They now are just getting back out into the field, excuse me, to do home visits. I'm just going to grab a sip. Sorry about that. To do home visits or to do applications over the phone. And they literally walk individuals and families right through the whole process from beginning to end. We often find also that there are people that all of a sudden lost coverage. They didn't even know they lost it through an employer-based process. Maybe they thought it would last longer than it would, or something just completely changed in their circumstance. They have never dealt with public health insurance before. So we literally walk them through from start to finish. And then there are other people that have been on the programs for many years and just need further guidance. Maybe they need help with more specialty care or access to a certain service or provider, and we can focus on that for them. So hopefully that clarified a little bit on open enrollment. And we will head to the next slide if no one has any questions. I wanted to touch base on some of the key areas of focus that we at Fidelis Care and across the state are working on to assist those that are in need. We seem to find that there are certain target groups or areas of individuals that possibly we'd want to focus on and make sure they get all the health insurance help that they can get. Specifically speaking, mental health awareness efforts. We want to make sure those individuals that need specific mental health treatments or programs or services, that they're getting the best access to health insurance that they possibly can. We know it's a challenge for them, that often just some of the day-to-day things that they're handling just on the end of going to all their doctor's appointments or counseling appointments or other can be an issue, let alone the health insurance world. So we are making sure that we are focusing on those individuals and making sure that there is no issue with coverage, no lapse in services, that medication needs are being met, and any types of referrals that are needed for specialty counseling or rehabs or other programs are at the forefront of our focus and that we take care of them. Another area of focus for us are women or children's health awareness efforts. What we seem to have found, specifically speaking over the past 17 to 18 months, are that dental needs, vision needs, and healthy initiatives for many families have gone by the wayside. Just even the access to get into a dental, so many dental providers were closed for so long, or just limiting their visits to the point that a child could only go in the office and mom or dad or guardian wasn't even able to go in. That can be so scary for a young child or for someone who needs specific services such as cavities or detailed cleanings or other. So we're focusing on this group to make sure that they're not losing sight of the whole main purpose here, which is to have health insurance to stay healthy. We really want to make sure those specific individuals and people continue on with their health insurance, and we advocate for them to get those services. Our next area of focus are small business focus and efforts. I just literally give a hats off to small businesses right now and all the things that they have had to deal with and had to go through, and hopefully have accomplished so much, and so many that have sustained and gotten through the storm. But they also often, we find the small business owners and their families sacrifice the most, that they would give up paying for health insurance to keep the doors of their business open. Or they would, not go to that specialty appointment because they don't have anybody to watch their shop or anybody to take over. So they miss appointments or they don't get prescriptions refilled. So our focus right now is to make sure those small businesses start to access health insurance and all of the services that they really and truly need. Without them, if they're not there and their doors are closed, it's just another business that, may not be able to thrive through this. And we want to see that. We want to see them succeed in so many ways. So we're very, very fortunate through Fidelis to partner with many of the local chambers of commerce that we can assist that way. That's one of our efforts that we help. Also offering some of the small businesses just need the education on these programs. So we offer different seminars and informational sessions to get these business owners on track with their medical needs. Lastly, key areas of focus for us are in-person engagement through the community. So this is just starting back up for most insurance companies, and through the New York State of Health is to be back out in the community. We always say, that's where you find the people, is that they're out and about. And now people are finally getting back out to fairs and festivals and activities. So we are right out there with them now to make sure that they are aware of all of these things that have changed in public health insurance. Great, and we'll head to the next slide. So a huge area, I'll say specifically with Fidelis, but really many health insurance companies across the state, is that starting in 2021, Fidelis Care wants to assist those in need of other services to get the correct resources to them. So not only are we helping them with health insurance, but as part of their health insurance application process, we are assisting individuals with food assistance. And the reason we say just food assistance is, again, we are seeing all of their income, all of their household composition, everything that encompasses their life is right in front of us. Not everybody qualifies for SNAP program, excuse me. So we don't just say that it's just SNAP assistance, we say it's food assistance, because there's other programs out there. There's different pantries that they could reach out to. There's different programs through the Food Bank of Central New York that they could access services to, the program that they can pay a certain amount and receive food. So there's different things. So we leave it as a general food assistance that we are able to help and give resources to through the application process. Also SSI, or Supplemental Security Income Assistance. This is different than Social Security, either disability or Social Security retirement. We found that through the process of health insurance, there are many that don't even realize that they could look into SSI, or Supplemental Security Income, as a resource for them. This generally comes for people or individuals or sometimes children that have multiple disabilities or chronic conditions, have possible serious medical issues that are ongoing, life-threatening, that they just have dealt with and have tried to work through, and we offer them the resources to look into this for assistance. Also housing resources. So we are seeing, again, firsthand people that are coming to us and they are one paycheck away from not being able to pay for that apartment, and hoping and praying that, you know, something will change in their situation, whatever is going on in their life. We try to make sure we help with that. So housing resources is another that we can offer assistance with. Of course, through NEDA, I know, of course, you helped a lot with the rental assistance programs. So we referred many times back to looking into those rental assistance programs to help them pay for their rent at that time. And let's see, I think there we go. And then just any other resources is necessary that we need to help with. So, so just the social determinants of health, we see the snowball effect of it from that. We really do. Okay, and our last slide. The American Rescue Plan. So how this plays into everything with us in the health insurance world is that starting in 2021, with President Biden, he created and formed the American Rescue Plan of 2021. There are many different sectors that the American Rescue Plan touches. Unemployment assistance insurance is one area. Of course, all the rental and housing assistance, but another area was the health insurance. So as far as public health insurance, what this offered is lower premiums and more subsidies on all of the New York State of Health programs across the board. This gave expanded access to coverage, lower costs on a monthly basis, and it ensures that healthcare is truly accessible for all of those that need it. I'm going to give an example of this. Earlier, we had discussed our Medicaid, our Essential Plan, and then, of course, the higher level, the Qualified Health Plan. Remember, I had stated to you the Essential Plan is like that medium income range. You pay some to be in the program. You have lower, not very expensive co-pays, out-of-pocket expenses. It's still considered affordable. With the implementation of the American Rescue Plan, all of the monthly premiums have been waived across the state. So they no longer have to pay that monthly out-of-pocket premium at this point in time. And it's just unbelievable. I mean, you go from people that are hoping that they can pay that health insurance premium to now getting a notice in the mail that it is now free. So huge difference for them. With this American Rescue Plan, we anticipate that these subsidies and lower premiums will be in effect until the end of the 2022 coverage year. So what that means is those people that have gotten that reduction in premium or that reduction in the subsidy, they will have that throughout the whole next, well, geez, now 13 months. We do not know if it will go longer. It may, depending on funding of the program and how funds are utilized, et cetera, et cetera. But what a great benefit. Like, it's at the point, like, no one should go without insurance because it is the most cost effective it could ever be at this point in time. And then I just put a category for other questions and comments, and I'm open for anything if anybody has any questions.
We also have a couple people on Facebook watching. And so if you're on Facebook and you have some questions, feel free to put them in the chat. I think you should be able to see that on my phone here. So we'll give them a few minutes as well. Anyone here on Zoom with any questions?
I have a few questions for you, Stephanie. You had actually brought it up with the American Rescue Plan, but what, when Congress passes the new legislation, what types of things might you be anticipating through the Build Back Better with Biden or the American Rescue Plan? Is there anything that we're looking at or looking for with healthcare, with the health insurance?
Or is the access coverage and that right now this is doctors.
Hang on just a minute, Stephanie. We're having some sound quality issues. So I'm going to have us all go on mute except for you, and then maybe try that one more time.
Is that better? No.
Is anyone else having difficulty hearing her?
Can you hear me well?
Yes.
Okay.
So I wonder if you've got a microphone issue, Steph.
Is that better?
No.
No. Let me go on mute and see what I can.
It's so funny because it was fine all along.
That's so odd. Anything?
Oh, now you're good. Now you're good.
Okay, good. I honestly just rearranged the speaker. Like, I hit it on and off. I'm like, okay, good. Perfect. Okay, so to answer your question, Taisha, so what we anticipate and hope for, I would say it's our wish list. But again, that of course would depend on federal funding and federal budgets and what their intentions are with anything going forward. But the largest for us right now is expanding the access to coverage. And what I mean by that specifically is that right now, many providers, specialty offices, urgent care facilities, and hospitals only participate with certain health insurance companies. That's just how it works. It's a network of providers that they're working with. We're hoping for expansion of those services, that more specialists will take these programs, especially more dental offices, more oral surgeon, more vision. Just having that limit, it funnels people down to the access to care. So with that, you get a large group of people that have the insurance, but only these providers take it, and these amount of specialty providers, and it just dwindles down and funnels down that not everybody is getting the care that they need because of the access to coverage. So we're hoping on the back end of it, let me explain a little further. What that would mean is possibly the American Rescue Plan or other programs implemented would offer more funding to the providers to assist in programs like this, so they would be more apt to participate and take them and be reimbursed at a rate that would be cost effective to them instead of cost prohibitive to them. So that's what we're hoping for. We're very grateful at this point for all of the expansion in the subsidies and the lower premiums and the services in general, but more providers.
Thank you.
Mm-hmm.
Any other questions?
I have some more questions.
Go right ahead.
So when we were considering, what our next Financial Friday was going to be about, healthcare came up. And one of the things that we had talked about was, cost effectiveness with healthcare in general. And, so maybe it's not as cost effective. So I have healthcare through my work, but if I had kids, is it also cost effective to do the family plan, or might it be cost effective to maybe do a little bit of maybe me do as an individual, but maybe my kids are on the marketplace or whatever the case is. So one of the things I was just curious about is, when you're talking to people about, creating their healthcare plans or their insurance plans, like cost effectiveness and how that might how you might help families get the plan that's best for them.
Absolutely. We see more often than you would realize a family. I'll give an example, a mom and two kids. Mom is on commercial insurance through employer, and instead of her opting for a family plan, which can literally be hundreds and hundreds of dollars per pay period or paycheck, she would put the children on Child Health Plus. And we see that more often than not. She can then bump down to a single plan. And again, depending on her healthcare needs or her circumstances, sometimes people even do a health savings plan or a high deductible health plan for themselves through their employer. And then they know children through Child Health Plus, ages 0 till their 19th birthday, are 100% covered. They don't even have a copay for a prescription. They don't have a copay for anything. So mom would pay that monthly premium, whatever that may be, for the Child Health Plus, and then she knows they're covered 100%. So we see that often. And what we recommend is that, generally speaking, open enrollment for employers is going to be right about the same time right now. The dates may not align exactly. We see, generally speaking, most employers' open enrollment dates go from sometimes in the mid-October range to early November, or sometimes early November to about the third week in November, right before Thanksgiving time frame. So there's a little difference in time frame. It doesn't go all the way into the December, January time frame, generally speaking, for most employers. That's because they have to prepare for the next year for whatever they're anticipating and whatever they're getting in for enrollment. That benefit year has to be created and planned for 2022. Excuse me. But they can, at the time that they get their open enrollment information, absolutely look into all resources. We always encourage people to not drop your commercial health insurance. We do not want anyone to just run out and drop their coverage, and all of a sudden they go, well, I dropped it because I'm going to put my whole family on the other insurance. Find out all of the details first. Give one of the enrollers a call. Make sure all your dates line up. Make sure that if one plan is ending, the other's picking up the next day at 12:01 at night. Make sure that all of the services that you need are 100% guaranteed. Or the biggest one, make sure you don't just switch blindly and then you go to make a doctor's appointment and you realize your child's pediatrician isn't in that network. So we encourage you to educate yourself, but absolutely there is the option to do that. Take a look at your commercial versus this option.
So Stephanie, we had a question from Facebook, from friend Dallas on Facebook. If you have base health insurance through work, but it doesn't cover vision or dental, can you get just the vision or dental through the marketplace?
So what we can take a look at is, based on your household composition and your income, we can take a look to see if you qualify for Medicaid as a secondary coverage. And if you qualify for Medicaid as a secondary coverage in conjunction with your primary normal commercial health insurance plan, we could apply for you for that straight Medicaid, which would include dental, vision, extra services that you could get access to. You would not be able to join a health plan on top of the plan that you already have, but you essentially would have your health plan that you already have through your commercial insurance, and then Medicaid as a secondary if you qualify. In saying that, though, I still get people that question, go, well, can't I just buy the dental and vision? No, you cannot just buy it out. You have to qualify into the program based on that household composition and the income.
Thank you. Other questions?
I have one more question. um, all of this is amazing information, and thank you so much, Stephanie. If I needed help with translation, if I needed Spanish or Arabic or whatever the case is, where might I go to get that information, or how might I go about getting that information?
We utilize the language line services. Utilize any language that you ever could think of. So we contract with that organization. Our enrollers actively have them ready at any point in time. Often what we find is that some people just say, I don't speak English, or they'll just state the language, Spanish. Or so we will get that assistance to them. Remember, everything's confidential. Everything that we discuss is very personal information. Like we said, your income, your household, social security numbers, where you're working. So this would encompass all of those confidentiality, HIPAA, PHI regulations to the fullest, and getting you the assistance that you need in the language that you prefer.
Oh, wow. Well, thank you, Stephanie. This has been, it's a lot of information. I find it intimidating. Yeah. And I think, you know, especially when you throw kids into the mix, when you throw ongoing health considerations. I mean, I've just been, you know, dealing with dental, and I drove to Buffalo for some dental work, if you can even imagine, which you probably can. So it's also so personal. And I think in this heightened time where people are getting sick, it's very scary. So thank you so much for taking time for us. I am assuming that people can reach out to Fidelis Care if they need assistance, or their own health insurance company or a broker. Is that correct? So
yes, absolutely. Absolutely. There are so many agencies help. So if you're not sure, I'm sure we can, anybody who has a question or anything on Facebook, right out, we'll get you my direct contact information. Like that, we can. I always say, and I want to close in this just right before you get to the last slide, is that remember, every situation is what I'm experiencing in my personal health and my situation will be different from yours, Andrea and Taisha and Sarah, everybody who's on the call. Even though you think, oh, it might be very similar, every situation is so unique. So for us to just give a very basic overview like that, you may have specific things that come up in your situation. So it's best to take that few minutes of a call, let us delve into it, see what we can do to help you, because your situation may not be like anyone else's. And we deal with that all the time. We're the pros in that we will handle that. So
that's great. That's great. And what a wonderful message. Everybody's situation is different. It's true for healthcare and health insurance costs. It's true for all your financial issues. So that's a great segue into my encouraging people to reach out to the Syracuse Financial Empowerment Center, which is a place where you can get, if you're a Syracuse resident, you can get free financial counseling. Sit down one-on-one with a financial empowerment counselor. Financial empowerment comes when you feel in control of your financial life and confident in your ability to make good choices, whatever direction it takes, and that includes choices about your health insurance. You can schedule an appointment today. You can visit their website at www.syracusefec.org. The phone number's here on the sheet. If you can't find it later, you can reach out to Nita and we will send you to the Financial Empowerment Center. I use them. I think they're wonderful. They're sponsored by all these amazing organizations down here at the bottom. But most importantly, that person will sit and talk about what you need and what your goals are and what your situation is, so you can get a stronger financial footing regardless of what your income is. We have Financial Fridays are every month. So in December, we are going to talk about holiday spending and saving, because we know a lot of people, it's easy to get down that slippery slope when you are hitting the holiday season. So December 3rd at noon, we'll be here on Zoom. And of course, we'll post it to Facebook as well. In the meantime, when you hit Black Friday, don't overspend. Make sure you go in with a budget, and know that everybody loves you regardless of whatever gifts you might be buying. But we'll have Colleen Barton from Visions Federal Credit Union join us. Taisha, do you want to talk a moment about the membership meeting?
Absolutely. So on next Tuesday, the Cash Coalition is inviting anybody who might be interested in becoming a member of the Cash Coalition. Right now on this call, we have Stephanie, Andrea, and I who are all members. And what we do is try and help our community with their financial stability, education, and also with things like tax returns and health insurance and whatever it might be for that individual or family. So if you are interested, please reach out to anybody on this Zoom right now, Stephanie, me, Andrea, and we can definitely get you registered for this meeting. And I think it'll be a nice opportunity to learn a little bit more about what the Cash Coalition does and how it might benefit your organization. And if you're interested in joining, how you might learn from the group that's a part of the coalition. So I hope you'll join us, and please feel free to call. Thanks.
Thanks, Taisha. And Stephanie, thank you again for joining us today. We really appreciate your time and your expertise. I just love how open-hearted you are when you come out to the community and you really want to connect people with good, solid information. And it's so important, and we appreciate you and Fidelis for this. And we will look forward to having you back at some point. Thank you so much.
Wow.
Okay. Thank you.